Welcome to the Community Analysis presentation of Hudson, Florida by Donna Terboli. This presentation will discuss the historic overview of Hudson, make a community analysis, discuss community problems, and discuss a global community issue. In 1700, Seminole Indians roamed what is now considered Hudson. It wasn't until the 1870s when a man named Isaac Hudson arrived in this part of Pasco County. He brought in cattle and wagons in hopes to find farming land. In 1887, he founded what is now Hudson, Florida. Initially, he wanted the same name of the town to be called Hudson's Landing. However, it was shortened to just Hudson. Early homes in Hudson were built from lumber from the surrounding forest. Settlers helped each other build houses, hunt food, farm, and fish. In the early 1900s, Hudson was thriving. A railroad linked Hudson to Tampa, and the lumber industry was doing very good. However, by the 1940s, things were not so well. The lumber industry went bankrupt due to overforestation. The railroad had to close due to the lack of business from the lumber industry. Hudson economy didn't turn around until 1950s when W.L. Hendry came here. He had an idea to create a neighborhood made from digging inlets from the coast. This was successful until the state of Florida forbid the inlets from being developed further. In the 1980s, further expansion of Hudson was done. A Kmart, Winn-Dixie, and many fast food places were established. U.S. Highway 19 was expanded, and today Hudson Beach is a thriving little town on the Gulf of Mexico. The population in Hudson today is 12,158 with an estimated 35,000 additional residents into Pasco County each year, some residing in the Hudson area. Hudson has many different community types, as do most of the surrounding areas. There are single-family homes, 55-plus communities, mobile home communities, apartment homes, condos, waterfront properties, and rural properties. The single-family homes were mostly located in deed-restricted communities, and they are mostly well upkept. The community of Beacon Ridge has a nicely kept golf course which is available for the public to use. Some of the mobile home communities or homes not in deed-restricted areas are run down and not as nicely kept. Rural homes were either mobile home or single family. Most of them were well upkept as well. Some of the rural homes even had farm animals surrounding them. Hudson also offers housing subsidies and homeless provisions. Jericho Road Ministries is a homeless shelter in Hudson. It provides food assistance, family assistance, and personal care needs to those who are homeless. Hudson has an elementary school, a middle school, and 2 high schools within its boundaries. Unfortunately, there are no college or educational training facilities for higher education within Hudson. Residents need to travel to neighboring cities in order to further their educational needs. The public library offers resources to its residents. Not only are there books available to view, but there are also workshops, children's programs, DVD rentals, and computers available for them to use. Hudson also offers many parks and recreational activities for its residents. There are multiple wilderness parks, which are great for biking, jogging, walking. There are equestrian trails and hiking trails. There are also playground, camping sites, picnic pavilions, and volleyball courts available for use. Unlike some inland communities, Hudson offers direct Gulf access, which is great for swimming, fishing, and boating. The population of Hudson is an aging community with 34.8% of the population being 65 or older. According to the CDC, the increase in the aging population across the United States is estimated to increase from 12.4% in 2000 to 19.6% in 2030. This trend will lead to an increase in healthcare services and cost. There may be an increase in long-term care spending as well as an increase in medical services, which will challenge not only the family but also the community and the country as well. Another concern for the area is that the community is 95.3% white non-Hispanic as compared to Tampa, where there is more diversity with 64.5% of the people being white non-Hispanic. Problems with communities being of one race can lead to stereotypes based upon the person's ethnicity, leading to healthcare disparities. Chlamydia is the most commonly reported sexually transmitted disease in the United States and Hudson. The CDC estimates that there are approximately 20 million new cases of sexually transmitted diseases yearly in the United States, costing at least $16 billion in direct medical care costs alone. The leading cause of death in Hudson is from heart disease, which is 152.9. This is the same as the nation. Smoking, poor dietary habits, and not exercising adequately are contributors to these diseases. Hudson offers many health-related resources. Bayonet Point Regional Medical Center is the only acute care hospital located within Hudson. It is a level 2 trauma center. It also has a 24-hour emergency department and is certified chest pain center. RMC offers classes and events to the community such as blood pressure checks, CPR classes, and nutrition classes. There is designated nurse line to assist the community with locating a physician or answering health-related questions. It accepts most medical major insurances and Medicare and Medicaid. There are programs set up for those people that are financially needy or that have no medical insurance coverages. There is an urgent care center named MedExpress, which offers care for cuts, bruises, fractures, sprains, colds, pneumonia, bronchitis, rashes, vomiting, immunizations, physicals, asthma, and wheezing. There is an on-site pharmacy which is convenient for picking up prescriptions. They take most medical insurances and private pay. However, they do not offer services for uninsured coverage. Hudson also offers a variety of primary care doctors, assisted living facilities, and long-term care facilities within the community. They take a variety of different insurances and also work with the unfunded population to meet the needs of the community. Healthy People 2020, we are going to discuss the health-related quality of life and well-being, which is HRQOLWB-1. Health-related quality and well-being is an initiative to improve the quality of life and well-being for all individuals. Underlying this participation measure is the principle that a person with a functional limitation can live a long and productive life and enjoy a good quality life. This goal can encourage leaders of the community to create a shared vision for the future of our community. It will lead to social, mental, and physical well-being of all members in the community in which we live. The second goal for Hudson would be to reduce the number of adults who use tobacco, which is TU-1. Tobacco use is the largest preventable cause of death and disease in the United States. By promoting smoking cessation, community leaders will decrease the risk of disease and premature death. And finally, we'll talk about heart disease, which is HDS-1. And the leading cause of death in Hudson is from cardiovascular disease. This goal is to increase the cardiovascular health in the U.S. population. Community leaders can use this to develop programs to increase physical activity, smoking cessation, and promote healthy eating. Hudson also has a variety of environmental resources available. They have adequate water, sewage, and sanitation processes. The water supply is monitored 24 hours a day to ensure that it is drinkable. Sewage in Hudson can be by city or septic tank. Individuals must monitor their own septic systems and notify appropriate companies if problems arise. They have programs for solid and hazardous waste disposal. They also provide vector control to prevent the spread of disease such as those from mosquitoes. However, one of the things that Hudson does not participate in is mandatory recycling. It is only optional. Recycling is important because the amount of waste has a negative impact on our environment. This would include harmful chemicals and gases that are released from the air from landfills. It is important for mandatory recycling in order to preserve our natural resources so we have those for future generations. Pasco County Sheriff's Office is the police for Hudson. It is dedicated to fighting as one to build a more just, peaceful, and flourishing Pasco County so that every citizen and everyone feels safe and protected. They have programs set up for children ages 5 to 13, which will bring children in the community together to play sports and do cheerleading. This helps promote physical fitness and sportsmanship. They also participate in the Florida Sheriff's Youth Ranches. This program improves the lives of at-risk youth by providing mentorship, activities, and positive experiences. Pasco County Animal Control Services is responsible for pet ownership through education, legislation, incentives, and sterilizing of pets. The goal is to save 90% of the pets that enter the shelter. They also assist in picking up stray animals, animal bites, and aggressive animals, and offers low-cost rabies vaccines and microchip clinics to the community. Firehouse 39 offers or services Hudson, Florida. They respond to vehicle accidents, medical emergency, hazardous waste emergencies, and fires. They offer adult safety programs, fire safety in the workplace, juvenile fire setter intervention programs, seasonal safety, and fire prevention programs.
Pasco County government is the government that services Hudson, Florida. It is made up of 5 county commissioners, a county administrator, and also the clerk and controller of Pasco County. The commissioners are responsible for the legislative and policy-making body of the county government and make all budget-related decisions. The county commissioner is responsible for overseeing the budget and the day-to-day operations of the county government. The clerk and controller of Pasco County provides information management, record keeping, and financial management to the circuit court, and county government. There are different avenues in which citizens can contact their city officials. They can call, email, or attend community meetings. Meetings are held every other Tuesday at the West Pasco government offices in Dade City at the historic courthouse. These meetings are also available online or live broadcast on the 24-hour Pasco TV station. The budget for Hudson is through Pasco County. It is set up to meet the needs of the community and addresses government issues, safety, education, and the environment. Expenditures of the budget include road repair and improvement, jobs and economic growth, public safety, and conservation efforts to protect our natural resources. Smoking is a major concern in Hudson. Adolescents and adults can be seen everywhere smoking. Nearly 1 in 5 deaths can be related to smoking in the United States. There are 480,000 deaths annually and are contributed to smoking alone. Smoking increases the risk of cardiovascular disease, stroke, and lung cancer. It increases healthcare utilization and cost. Obesity is a major concern for Hudson. There are multiple fast food restaurants available for residents to eat. Heart disease, stroke, type 2 diabetes, and certain cancers are all medical conditions related to obesity. In 2008, the annual cost of obesity was at $147 billion. Community efforts should focus on supporting healthy eating and promoting physical activity. Major concern in Hudson. There are a number of residents of Hudson who are smoking, overweight, and make poor dietary choices. Cancer is the leading cause of death in Florida with an average of 100,000 new cases reported every year. Hudson has an elementary, middle, and high school within its boundaries. However, to further education, residents need to travel to surrounding communities. 79.2% of households have high school diplomas, but only 22.3% have a bachelor's degree or higher. According to the CDC, higher level of education reduces rates of chronic illness as compared to those with less education. Safety is another concern for our residents. Rural areas are not equipped with sidewalks for children to walk to school on. They are walking down the side of the road or even on the road. This is dangerous and can lead to preventable accidents. Also, there are many people talking on cell phones while driving their vehicles. Research shows that drivers who only see 50% of all information in their driving environment when using a cell phone or hands-free device. Environmental surroundings can have an impact on health and well-being of residents of Hudson. There are multiple fast food restaurants, too many single passenger cars, and too much promotion of smoking and drinking. By changing the environment and promotion of healthy choices, we can increase the possibility of living healthy. The community needs were prioritized according to the needs of our community. A global community issue is obesity. Obesity affects more than 12.7 children and adolescents and 36.5% of adults in the United States. Per the World Health Organization, 65% of the world's population live in a country where overweight and obesity kills more people than underweight. Globally, 44% of diabetes, 23% of ischemic heart disease, and 41% of certain cancers are attributed to being overweight and being obese. The same initiatives are underway across the world as Hudson is to improve and help prevent obesity rates. Programs have been initiated in over 140 countries that encourage healthy eating and increasing physical activity. In addition to this, several countries have added taxation on sugary beverages. The countries include Mexico, Hungary, Philippines, South Africa, and the United Kingdom and Ireland. Community health nurses can improve education on healthy eating, physical exercise, and monitor progress of at-risk individuals to help curb this health problem. They are detrimental in seeking input from local communities to guide federal planning and decision-making related to the funding opportunities to better serve the community in which we live.